Do you feel like your body needs to bounce back from workouts, injuries, inflammation, stress, and now it just doesn't? The joint pain just lingers, your gut problems persist, recovery takes forever, and you feel inflamed all the time. Well, today I'm going to talk about some peptides, specifically the BPC-157 and the TB500, two of the most talked about healing peptides, but also two of the most misunderstood. I'm Dr. Myra Reed, an internal and functional medicine physician with over 35 years of experience. I practice early detection longevity medicine. I help people find what others miss before the symptoms become diseases. Everything I do runs through my 4 pillars: hormones, gut, lifestyle, environment. I help people live that smarter, stronger, longer. This is week 2, and today we're going to be talking about the healing and recovery peptides. I want to kind of start with like the big problem we have today in conventional medicine, which they don't ask, why isn't my healing happening? What's the root cause that's causing all of these issues? I like to get to why these things are happening, into these root causes, and then add things. Once we start doing the foundational work on things, then we can add peptides as a layer, as another tool. But I don't want peptides just to be the total answer, because we really need to do the groundwork first. One of the most dangerous phrases is saying, it's just aging. Slowing healing is not always age. Sometimes healing signals have changed. I want to tell you about a patient story. We'll call her Sarah. She's a middle-aged woman, very active, but she was trying to keep functioning, and she had multiple types of arthritis. She'd been going to the rheumatologist. They diagnosed her with 3 different autoimmune diseases, plus the degenerative changes. She was coming in for severe neck pains. Come to find out, she had chronic gut issues as well, and she had been to all these different specialists. She was given pain medications. She was told, just give more medicines, that quick in and out pill for an ill approach, more pain meds, more symptom control, but she felt worse. No one asked her, could it be her gut causing the inflammation? She came to me, I started thinking differently. First thing I like to do is go, okay, you're having all this inflammation. Let's start and look at your gut, because the gut is the window to the rest of the body. And if your gut's inflamed, then your body's inflamed. But I wanted people to understand that, yes, peptides are great, but I don't want to use them as the thing that people think is going to be the one solution to everything. It does dramatically help people, but you have to get to this foundation first. So again, going back to her, I started thinking differently, starting with the gut, looking at the inflammation, that leaky gut. How's her immune system? So we started, first thing is eliminating things. I changed her diet. We started looking at foods that probably were triggering her. That's when I started her on the oral BPC-157. I like these different types of oral BPC-157, but the one that really works in the lower part of the gut for inflammation also can have something in it that has KPV and PEA for pain and inflammation. After we made these gut and diet changes and added the PEA with the BPC, then I started adding the injectable BPC. The results were dramatic. She texted me 3 days later saying, oh my gosh, life-changing. All those years she'd been going to all these different specialists, each one giving her something different. And then once we started this groundwork and then adding and layering things, and on top of that, we're going to work on getting her off of these dangerous biologics. So not only is she feeling better, but we're going to get her quality of health better. We're going to optimize her health. This is what the goal, this is what I love to do with patients. Now let me explain what these peptides are, specifically on this lecture, is the BPC-157. That means body protection compound. It's originally connected from gastric proteins in the stomach that naturally produce these healing peptides, but they start diminishing with age. People will discuss them for, like I mentioned, the gut support, the gut healing, decreasing inflammation, tendon repair, and that recovery. So what about TB500 related to thymosin beta 4, often discussed for larger injuries, recovery, mobility, healing support? A simple explanation is that the BPC is for more targeted tissue repair and the TB500 is more systemic. It helps, they work together synergistically but separately. I also would like to discuss about another patient that comes to see me, and this is a really common problem that I see specifically. Let's just talk about knee problems, that knee inflammation. These patients will come in and say, I'm having knee inflammation, I'm going to the orthopedic surgeon, they're saying I'm going to have surgery in the near future. But what I want to say is that a lot of times we can delay or even prevent surgery by starting these BPC-157 peptides. They're not the end-all answer, but they are a tool. And if you still work on that foundational work of sleep, nutrition, getting good protein, your gut health that we talked about, the inflammation work, movement, then I'm going to say that is so needed before you add these peptides. Tell me, have you had an injury or a pain or some inflammation that just never completely heals? Drop it below. I read every comment. Next week, I am going to be getting into the GLP-1s, which has to do with weight loss, muscle loss, and the conversation that nobody is having. Everything I do, every patient, every protocol, every video runs through one belief: smarter, stronger, longer. Don't let your first symptom be your last.